Noreen would know.
All right. Okay.
It's
So I think,
usually under more, and then if you click more, it'll give you the let's look up. So it's usually under that part. Oh, there it is.
okay.
Thanks.
Okay. But we're going, right?
Yep, we're going.
We're going. All right. Let's jump in, everyone. Okay. So I, I'm not sharing my screen anymore, am I?
No.
Okay. Let's try this again. Okay. Now are we sharing the screen?
Yeah.
All right. So Medicare supplement plans. Those are also known as Medigaps, so it's interchangeable. Um, Medigaps are Medicare supplement plans. So about Medigaps, a quick overview of what we're going to be covering today. We're going to talk about eligibility. Your eligibility for MedSup is based on your enrollment in Medicare Part A and B. Um, it is aligned with the original Medicare system of care. Um, what a Medigap is primarily it's insurance to cover the cost sharing, which is the deductibles, coinsurance, and copays for Medicare Part A and B. So it's the things that they do not cover. Um, Medigaps do only cover things that Medicare Part A and B cover. So if they don't cover it, neither does your Medigap. We're going to talk about how the enrollment, there are protected and restricted periods involving your enrollment. We're going to talk about guaranteed issue rights and what those are. We're going to talk about the Medigap open enrollment period and why it is significant. Um, we have SHIBA resources for you to share with clients and for you as advisors to help understand the Medigap. What they are and what they cover. We're going to talk about how they are standardized plans. Medigaps are sold by private insurance companies. They are not part of Medicare. The insurance varies by the type of plan. All plans are, they're lettered. They name them per letter. And so each letter represents different coverages. So whatever plan you choose, all those letters, once you have like a plan A, everything that's a plan A has the same coverage. There's no provider network for Medigaps. Um, the monthly premium varies by the company that sells you the plan. So it's not dependent on the coverages, it's dependent on the company that's selling it. Medigaps are regulated by CMS in the state. Basically, CMS has regulations, things that have to be included, and then the states actually regulate the plans. They can add laws, change laws, do things, but it's then based on the state. So we live in Washington. We only sell plans that are approved in Washington, and those plans have to follow this Washington state laws and rules. So that's what you need to know. Um, After our review today, we hope that you leave here being able to explain what a Medigap is, that you can explain what the Medigap open enrollment period is, and why it is significant and the consequences of missing that opportunity. We'd like you to be able to use the SHIBA publications that we have and understand them so that you can explain to clients the coverages and the publications um, about being what is provided and how to tell what you're getting from your Medigap. Okay, so the Medicare system of care. As we've seen before, there is the original Medicare system. Whoops. Sorry, guys, didn't mean to do that. The original Medicare system and then the Medicare Advantage system. Medigaps are part of the original Medicare system. So this would be A, B, you can add a Part D, and you can add a supplement. That would be your Medigap. Okay. So what is a Medigap plan? Um, Medigaps, they are specific plans sold by private insurance companies. They are intended to cover the gaps from your original Medicare Parts A and B. So the the deductibles, the coinsurance, and the copayments. So when Medicare only pays 80%, you have a 20% out-of-pocket cost. Your Medigap is designed to cover that for you. With your Part A coverage, there's a deductible for going into the hospital. Your Medigap's going to cover that deductible. Okay, so as we've discussed, original Medicare Parts A and B, they do not pay 100% of all of your medical costs. You will have out-of-pocket costs along with original Medicare. One of those would be your prescription drugs. We've talked about getting a Part D plan to get coverage for your prescription drugs. Not all Medicare does not determine everything to be medically necessary. They only cover what they find to be medically necessary. And then when they do find things to be medically necessary, they do not cover them necessarily at 100%. So the Medigap is designed to help you with those coverages that are not paid at 100%. This is kind of what it looks like in the overall scheme of things. So what this chart represents is all your medical services, everything that you would need. So your prescription drugs, dental, vision, hearing. This whole outline would be any and all type of coverages that you would need, medical coverages. This green square is what Medicare has determined they will cover. Okay, so if you have original Medicare, A and B, this is what they're going to cover. This is stuff that they cover, but that's covered, but they don't pay for. Okay, so it may be your hospital stay where they're going to pay for it, but they've left you with a deductible or a cost share. After so many days, you have to start pitching in. Your Medigap covers these holes, the things that are covered by Medicare, but that they're not paying. Does that make sense? Is that clear to everyone? Any questions so far?
How is it that you say it's covered, but it's not paid?
Well, they cover it, but they only cover a portion. They pay a portion of it. So it's like they'll cover 80% of what they're going to cover it, but not in full.
Oh, okay.
Well, I have a question about dental and vision and hearing. Are they, oops,
Uh-huh.
are they covered by Medigap?
No,
No, okay.
no, they are not. And they are not covered by original Medicare. The Medigap only covers things that original Medicare covers.
Okay.
Okay. So if
Thanks.
Medicare doesn't cover it, neither does your Medigap.
Uh-huh. Okay. Yeah, it looked like on the picture that it doesn't cover. I just wanted to clarify
Yep.
it. Okay.
Yep. Good question. Okay. Eligibility and enrollment. So, so Medigaps are a little different in the eligibility. You still have to be a United States citizen or lawfully present in the U.S. You have to have both Part A and B to buy a Medigap. You need to reside in the state in which you buy the Medigap from. Okay, so you can't live in Washington and buy a Medigap out of California. You have to buy it from the state where you permanently reside. And each state has different, well, they don't all have different rules, but there are some variations in different rules among the states, different benefits. It just kind of depends, but the systems are a little different. You have to agree to abide by the rules of the plan. You need to complete the enrollment request. Basically, you have to fill out the application. You have to submit it during a valid enrollment time, and you have to pay the premium. The difference with Medigaps is the companies can have their own eligibility rules. So they can underwrite you, kind of like they do for life insurance. And they can say, your health is no good, we don't want you. So they can actually underwrite you for different, like, are you eligible for their policy? Do you meet their eligibility rules, their requirements? They do not have to, outside of the guaranteed enrollment period, they do not have to issue you a policy. So you can't have more than one Medigap. You really don't need more than one, but everybody can have a Medigap, just one. And if you have Medicaid, like full Medicaid, as your supplement to your Medicare, so anybody who has full Medicaid they cannot have a Medigap, and they wouldn't need one, because Medicaid is going to cover whatever those copays, deductibles, the part that Medicare doesn't cover, Medicaid is. So you don't need a Medigap. It's illegal for an agent or somebody to sell one to you. Okay, so how you enroll, and what you need to do, when enrolling. You want to choose the type of plan you want. There's 10 options, and again, they're lettered plans: Plan A, Plan B, Plan C, Plan D. Then you want to choose the company that you want to purchase it from. You request an application from them, and then you have to arrange payment. As long as you pay for it, once that policy is issued, that policy is yours. A lot of people we often recommend that you consider setting up the payment for your Medigap on an electronic, you're an automatic payment, an EFT payment, or something where it is automatically paid that you can't miss it, because if that policy lapses, you may not be able to get it back. You can apply to have a policy reinstated. You can apply for a new policy, but they don't have to give it to you. So you don't want to let it lapse. So the Medigap open enrollment. So what is the Medigap open enrollment? Unlike Medicare, your group policies, the Medigap open enrollment is a one-time event. The actual open enrollment period, it's a once in a lifetime event for people. It occurs, it's a federally protected, the federal government says you have to have this one guaranteed period to get a Medigap. It is when you are either 65 or older, so you have to be 65, and when you have both Part A and Part B. So when you're 65, you have Part A and Part B, you have a 6-month window in which you are guaranteed a Medigap. So the companies have to give you the Medigap, whichever plan you decide that you want. Outside of that six-month period, there are some very limited opportunities for you to get a guaranteed issue. Okay, but during that time, they cannot deny you a policy. They have to give it to you. Any questions? Okay. So open enrollment period. So for our friend Paul, whose birthday is April 6th, and he's turning 65. So his open enrollment period is going to be April 1st, and it's going to end the 6-month period September 30th. Okay, so he's going to be in April, he will be 65, and he's signing up for Part A and Part B. That opens his window, his 6-month guaranteed issue time frame.
I have one question.
Sure.
Yeah, so if people eligible for Medicare not because of age, they cannot get a Medigap?
they can get a Medigap. They may be able to get a Medigap, but they don't have that guaranteed issue unless it is that 6-month period. Okay.
Okay. Thank
Mm-hmm. So, and we'll talk about that a little bit more in a few slides. So the best time to get a Medigap. So the ideal timing would be in the month or two before you are turning 65 and you're starting Part A and Part B. Because like everything else, you apply 1 month and your coverage starts like the first of the next month, right? So you don't want there to be a gap. So if you wait until your birthday month to apply, it's not going to start until the next month. So then you'll only have your original Medicare that first month. You would not have, you know, the extra coverage. So if you can apply ahead and you can pick, you know, the date that you want it to start. Okay, so we're gonna kind of talk a little bit about the guaranteed issue rights. This first question, I didn't write the questions, so it reads a little weird to me. Um, but it's if you could, so you attain age 65, but you did not sign up for Part A or for Part B for more than 6 months, would you still get a guaranteed issue? And you would, but not at 65. You have to be 65 and when you get Part A and Part B. Okay. If you can get Part A and Part B before you're 65, so you know you're 63 and you've got it because of disability, you don't get the guaranteed issue until you turn 65. Once you're 65 and have A and B, then you get your guaranteed issue. Okay, so you can have one before that, but you only get the guaranteed issue when you're 65 and have A and B. Okay, so I'm going to assume that here you have a client that calls you and says, hey, I have Medicare. I've been on Medicare and I've heard about these Medicare supplements. You know, I keep getting these co-payments and I'd like to get a Medicare supplement and not have these co-pays. Can I still get that without having a health screen? And the answer is it depends. There are rules. The guaranteed issue period, it's going to depend. When did you turn 65 and when did you start your A and your Part B? A lot of people will turn 65 and get Part A, but they're still working, so they don't have their Part B yet. Their window for the guaranteed issue does not start until they get the Part B as well. So they're 65, have Part A, but they don't get the guaranteed issue period until they get the Part B as well. Okay? I know it's tricky, but it's important. So the things about Medigaps, Medigaps are good nationwide. So you know anywhere that takes original Medicare, your Medigap is going to cover you as well. You want to check with your providers to make sure that they accept people who have original Medicare. Once you buy a Medigap, it's yours. They have guaranteed renewability. As long as you pay the premium, they have to renew that policy. So you get it as long as you want it. Okay, once you have it, it's yours. The Medigaps that are sold today, you know, they have changed over the years, and we're going to look at a chart as to some of the plans that were available before. Way back when, there were a couple of Medigaps that included prescription drug coverage. That went away a long time ago. You cannot buy a Medigap plan today that has coverage for prescription drugs. If you want drug coverage, you have to buy a standalone Part D or have it coming from, you know, some other source, VA benefits, something like that.
Linda, this is Norma. I am having a hard time getting this. Maybe because we're on the third day, I don't know. Okay, so my question, and I've been going into that chat, I turned 65, I applied for A, I was still employed until I was 67. And
Mhm.
you answered that, but my extra question to that is, so once I was on A and B at 67, did I still have a 6-month window for Medigap?
So, okay. So the question again, you were working until you were 67 and you had
Yeah.
part A,
Yeah,
and then you quit working at
applied,
67 and got part B.
yes.
That's when your 6-month window would have started.
Okay, and then I have one more question and I'll shut up.
Oh, you're fine.
I'm confused about Medigap. Is this kind of hedging your bets? Are you betting that you're going to be hospitalized a lot? Is that why people would get it? Is to kind of hedge their bets that they're not going to have a boatload of debt if they are relatively unhealthy to start with?
Well, there's a lot of different reasons that people can get Medigaps, and we'll talk about that some because some of the people
Okay.
here in our group have Medigaps and some have Medicare Advantage plans, and we can talk about why some prefer one over the other. So we'll do that. w- we'll do that in a little bit, okay?
Okay,
So
sorry.
let's go. Nope, you're good. It's a good question, and it's really a personal preference, okay?
Okay, thank you.
Uh-huh. And I had lost the chap, so hang on, let me see. I found it here, the question and answer. So if you qualify for Medicare because of a disability or the diseases mentioned, you are not eligible for a Medigap. So it depends. You can apply for a Medigap. You may not get a Medigap until, so if you are on Medicare because of a disability, once you age into Medicare so that you now become 65 and you have Part A and B, that's when you get your guaranteed issue. So maybe you couldn't get it when you were 60 because nobody would write it for you. But when you turn 65, now you get that guaranteed issue and you can pick up a Medigap. Does that make sense? Ben, did you understand that? I don't know where Ben is.
He said yes, thank you.
Okay. All right. Okay. Okay, so questions. So what questions about eligibility do you think you might get? Or and if you don't have any now and you have them later, that's okay. But as far as eligibility and open enrollment periods, what kind of questions do you think you might get or do you have? We may have already addressed them. Go ahead,
I
Yun. Uh-huh.
yeah, kind of a question like people who eligible, I mean, who get the Medicare because of their disability, let's say about like 60, then like 65, when they become 65, the open enrollment, you said that they can, I mean, Medicare cannot be denied. So
Correct.
is there anyway like like a 60, let's say they got the Medigap but the higher cost. But the 65, is that they can get benefit for reapply for like get cost
Oh,
down?
if they already have one, can they
Yeah.
reapply? So
Yeah.
in Washington, once you have a Medigap, you can switch to another Medigap at any time. There's a little caveat. If you have an A, you have to switch to another A. But if you have a certain plan, and we'll go over that in a little bit, once you have it, you can switch to another one.
So
It's getting it in the first
in the
place. Yeah.
When they become 65, their premium can be lower because they cannot be denied. I'm just
They,
curious.
they could pick a different plan. It's a little unique because of the Washington rules. We're going to look at a chart. So let's pick that up in a minute, okay? Okay. Any other questions?
I have a quick question. Hopefully it's not too dumb. If somebody, during open enrollment, if somebody moves to a different state, do they get an exception to start again, or do they have to wait till October? How does that work? Because you had mentioned that if they're covered in Washington and let's say they move to Arizona, then that coverage wouldn't work, right?
So no, the coverage does. A Medigap is portable, so you can take it with you. Okay. And when you move, then you have the option. You can keep the plan you have, or you could buy. You're given like a special enrollment period. It's smaller to buy a different one if you want from the state where you are. And some people want to do that because maybe it's a state that has better coverage or additional benefits, but not always. It may be a state that has less, and so you want to keep the one you have. You just can't buy, if you move, then you're a resident somewhere else and you can potentially buy a new policy there. Yes, Noreen, go ahead. Noreen.
So,
yes.
yeah, I'm sorry. Ask the question in the Q&A.
I can't hear you.
You can't hear me?
Now I can.
Okay. Ben asked a question in the Q&A. For dental and vision coverage, is the only option to find a Medicare Part C plan that offers those, meaning no original Medicare would cover that?
So yes, you would not get it. You would either have to get a Medicare Part C plan that had dental or vision coverage, or buy an individual dental or vision plan.
Do you mind if I just say one thing about that? A lot of people who do this, they actually opt to not, they'll just like work with their dentist, or the dentist offer cash packages that you can, pay so much money and get the 2 cleanings and x-rays and things like that each year. Or they'll go to Costco for glasses, things like that, because it's less than paying for those coverages. It's pretty common.
Right. But yeah, if you want to get the coverage for it, yeah, you can't get it through the Medigap. No.
I have a question, and this might not be the right time, but within some plans, like let's say G, they have high deductible and they have your regular deductible, but it's still, let's say, a plan G, or are you allowed to switch? Is somebody allowed to switch between the high deductible and the regular deductible? Because there's a difference in how much you're paying per month. Does that change are those considered 2 separate plans?
You can switch, and we'll talk about that in a little bit.
Okay, thank you.
Okay, so the covered benefits and costs. So let's look at some of those plans. So the monthly premium varies by the company that you purchased the plan from. Okay, and the plans are governed by Washington state laws and rules. So our plans are our plans. There's a difference in the way the Medigaps work because they're not Medicare insurance. They're not subsidized by Medicare. There's no contract with Medicare. They're private insurance companies. It's just you're buying a policy specific from an insurance company to cover just basically those gaps in your Medicare coverage. Okay, so this link is going to take you to, I have it up, I'm going to pull it over. You should have this in your workbook. It's going to take you to the Medicare approved chart. I believe it is in the back by your rainbow chart. In some of the binders, it's blue. it was blue. So if you want to pull yours out or pull it up and look at it, I'm going to bring mine over so that you can see it. But at some point I'm going to change back to slides, so you may want to keep yours up or out so that we can look at it. But here is, this is a product that we put out. This is a chart of the supplement or the Medigap plans that are available. This portion of the chart, it's actually updated quarterly. So April to June, then we'll have a new one that is for July through September. But this is the companies that are currently selling the plans, and there's multiple pages. So you can see this is just page 1. They're alphabetical: ACE, Assurus, Bankers, Cigna, First Health. Okay, so those are the companies. And these are the standardized plans. We have plan A, B, D, G, K, L, M, N, C, and F. So there's 10 plans that are currently available. Plan C and F, those are special plans. They're only eligible to people, or for people who were eligible for Medicare before 2020. Okay, so if you're just turning 65 now, you can't buy one. But if you're 71, even if you're just now applying for the Medicare, you would be eligible for a Plan C or a Plan F. Okay, they're kind of phasing them out. They've replaced them. G is kind of a replacement for C, and I can't remember which one is for F at the moment. But anyway, or F is for G is for F, C is for, maybe it's D. I can't remember. But anyway, so, but these are the plans, and this will tell you if they cover pre-existing conditions and if they require health screenings. Okay, so this is outside of your guaranteed issue period. Okay, this is if you're just trying to apply at any time, that's where these would apply. So these are the different options. I'm going to just scroll to the end. The last page of our handout is going to include the 10 standardized Medicare supplement plans. So this talks about the different plans: A, B, D, G, K, L, M, and F. And it tells you what the benefits are that are covered by those plans. So we'll talk about that a little bit more in a minute, but what I want to do is give you a little practice in reviewing this chart. And we're going to focus primarily on Plan G. Plan G is the most comprehensive plan. It covers the most things. It is the most popular plan that is purchased right now. It does come in your regular option and with the high deductible. You can see there's quite a difference in premium. And with the Medigap, you pay a monthly premium. The difference is with the high deductible plan, there is a deductible. It is, oh, and it's on here. What is the high deductible amount? Maybe it's on this last one. The high deductible is $2,870. So you would have to incur that amount of expense before your Medigap would kick in. Okay, so if you buy a high deductible plan, you can figure you're going to spend this before your plan starts paying. Okay, so using your chart, let's look and see what the range in premiums can be. So who can tell me what the monthly premium for a Plan G is for a Cigna plan?
$225.
That's right. Anybody else see anything different? Okay, how about State Farm?
$278.
Everybody agree? Okay, it's what I saw too. How about USAA?
235.
That's right. Anybody having a hard time finding the information?
It was a bit challenging to find it on the Medicare, I mean the OIC website, but I found it eventually.
Oh, on the website?
Yeah.
Are you from the chart that I was just showing you were able to find it easily from the chart, but you had a hard time finding the chart?
No, I found the chart, but via the OIC website. But it just took me a few clicks to find it because I did a search. Yeah.
Yeah. Okay. But then once you found the chart, you were able to find the premium for the G. Okay.
Yep.
All right. Anybody have any questions about the premiums and how to find those? All right. So now we're going to talk more about the different types of plans and the coverages. So again, they're standardized plans. Any plan A is going to have the same benefits. Any plan D is going to have the same benefits. Okay. We talked about this already. C and F are only available to those who became eligible for Medicare prior to 2020. Okay. If people have other lettered plans, they are guaranteed renewable for as long as they have the plan, but they're no longer available in the market. So there were some plans, it's the ones that they no longer sell them. So if you had one that included drug coverage from way, way, way back when, as long as you keep paying for it, you can keep that plan, but they aren't selling it to anybody new. Okay.
I can just add a little comment to that. I have a friend of mine who lives up in a very rural town, and he pays a lot for his supplemental. And I think it's one on here that's not sold anymore because it's prescription. And you know, I was saying, gosh, if you got on a Medicare Advantage plan, you would save $500 a month. But I think his concern is, you know, like you said, if he cancels that, he'll never get it back because they're not selling it anymore.
Right. And
so,
yeah. And he would most likely have a penalty for his prescription drug coverage going forward because those aren't credible coverage.
oh, why aren't they considered credible coverage?
Because they're old, and that was just the way it was determined. They had an option to switch at some point, and those who didn't take it, now that's the drug coverage they get. But basically, if they get a new standalone plan, it's like not having it, and so they would have a penalty.
God, that hardly seems fair.
Well, but they told them that's the way it is. So
Wow.
yeah, so that could be it. So anyway, the Medicare Supplement Plan G, again, this is the most comprehensive plan that is available. It is the most common, and it's kind of what we're going to focus on today. So what I want to do, I want to look at this chart. So you have this chart, and what I want you to do is look at, oops, where did it go? There we go. So if you look at the supplement chart here, so I want you to go to this last page where we talk about basic benefits, A, B, C, D, G, etc. Okay, I want you to look at there. Then I want you to look at this chart, and I want you to tell me, under Medicare Part A, if you had a Plan G, how much are you going to pay if you're hospitalized? So the Part A coverage for hospital coinsurance What is your Medigap going to pay? What is it going to leave you to have to pay for your hospitalization? Does that make sense? Zero. Yeah. Because your plan G is going to cover it. Does that make sense? How about what would your deductible be for your Part A coverage?
257. No, that's Part B.
That's Part B.
Nothing.
Nothing. That's right. And how about if you're in hospice care and there you have a copay or a co-insurance for your hospice care? How much are you going to have to pay if you have a Plan G?
Zero.
That's right. So how about if you get blood? Okay, so if you have you need to get blood under your Part A, how much are you going to pay for your blood if you have a Plan G?
Zero.
First
Up to
pints.
Yeah, zero up to 3 pints.
How about if you have a Plan K?
50%.
50%.
That's right.
Hey, Linda, really quick. It looks like Norma is asking what page she should be on right now, or looking at this information.
Sorry, I found it.
Oh,
okay.
Okay.
Sorry.
That's okay. Okay. So under your Part B, if you had a Part B deductible, what would you have to pay for your Part B deductible if you have a G plan?
257.
Yeah.
That's right. Because the Medigap part, or the B does not cover your Part B deductible.
Right. Yeah, that's right.
And that's the difference really between a G and an F. The F plans actually covered your deductible.
Covered everything.
Yep, that's the primary difference. Okay. Any questions about that? Does that make sense how to read this chart? So that you can compare all A plans have, let me go back this way. So all of your A plans are going to cover this. All G plans are going to cover these items. All L plans are going to cover the same. So an L plan is an L plan. The biggest difference is the company, and you'll see that the price can vary greatly depending on the company that you purchase it from. Okay. So the cost sharing, your cost share, your portion is going to depend on which lettered plan you buy. And that's basically it. If you want a G plan, you really don't have cost sharing. If you get a K plan, you have some cost sharing. They only cover like 50% of several of your benefits. So we have a booklet that is available. It's on our website. I was trying to find it earlier today to show it to you, and I was having some difficulties finding the link. We did just update our website. And so I'm not sure where the link went, but you can find it, the public facing link where you could just go as an individual and look for this supplemental guide. I couldn't find it that way. It is in our My SHIBA pages, the pages for the volunteers. I'm going to show you here that it is in our publications page. Under our publications, you can find it here. And this is where the booklet is, what you need to know about Medigaps. Okay, it looks like this. And there's a PDF version online and a lot of information about the Medigaps there. Okay, we do have it in a paper form and you can order it, but you can get it online there. And I'm just not sure what happened to the public facing page. I'm going to have to look into that. Here's our U draw U chart, original Medicare or a Medicare Advantage plan. If you have commercial employer Medicaid, how the plans fit in, where your Medigap would. It wouldn't here. If you have a Medigap, you could buy an individual. Some employer group plans offer Medigaps, so it could be an employer group plan. And then you wouldn't, if you had Medicaid, you wouldn't have a Medigap. Okay, so does anybody here have a Medicare supplement plan now? I know, yeah, Don, I knew you did. I don't know if anybody else does. Do you want to tell us about your plan? Is it one that you bought individually? Did you get it as retiree coverage? What lettered plan is it? And do you want to tell us why you have a Medigap versus a Medicare Advantage plan?
We have, my wife and I each have a Plan G through Regents. Because we both have it, we get a discount on the monthly premium. We've done some foreign travel, so that was part of the equation of what we wanted to, why we wanted a Plan G, because it covers 80% of anything in a foreign country. I think I mentioned the other day that when I was on the Med Advantage plan, it was hard to find sometimes a specialist. I needed to get referrals. I don't have to get a referral if I want to go to an orthopedist on the Plan G. I just make an appointment and go. There's no co-pays. The only costs we have is the Part B deductible. And part of what prompted me toward the supplement plan is the way the Med Advantage plans are funded makes me suspicious because it's to the company's advantage not to spend money on their customers. That's my own personal opinion. So that was a factor as well.
Clark?
Wait, did you have a question about what he said? So, so one of the things, it's kind of with the Medicare supplement or the Medigap, you know what your monthly premium is. So you know you can factor in, it's just kind of like right now, you know, or before you go on Medicare, you know that you have to pay this much every month for your plan. So you know
Right.
it's going to cost, so you can kind of budget.
Yeah.
And you should never, you know, if you have any additional expenses or you end up in the hospital or you need care, you pretty much know that you have to pay your monthly premium and all those other pieces are going to be covered by the Medigap. When you have a
Correct.
Medicare Advantage plan, it depends. You could need a lot of treatment and end up with a lot of copays. And even if they're only $50, but $50 a pop, if you have 10 of them, it's $500. If you have, you know, other cost shares, other things, so it can vary. And it's just not as, you just don't know. So some people like it that they can plan and know that this is what it's going to be. It's never going to be more than, you know, my $200 premium. But
Yeah,
of course,
that's correct. Right now I'm healthy and I don't spend, or I wouldn't spend much more than the premium, but I'm 75 years old and that may not last.
right. And if you do end up needing a lot of care, then you're still looking at just the premium.
Right.
So, so that's why. Was it Norma? Did you ask why somebody would want a Medigap
Yes, I
versus a med.
did. Yeah,
Does that
I did.
kind of help?
Yeah, thank you, Don.
Yeah, my question is, why would anyone want a Medicare Advantage plan?
Well, a lot of people do. There's a lot of other benefits and things that come with it. And a lot of people, if they're reasonably healthy, they're not having to pay a monthly premium. So they're just, it's, well, I've got the coverage, and then if something happens, I have to worry about it. But as long as I'm healthy, I'm not paying anything per month. So it's just kind of a give or a take. It's there's no right or wrong. It's just a personal preference. Okay, so what we've got here, covered services. So Medicare Part A, deductibles, coinsurance, copays. These are, I think this is maybe supposed to be Part B, but so this is what your Medigap is going to cover. And this is what you're going to have to pay out of pocket for your Medigap. You pay the premium, and then if you have any percentage of cost sharing, that will be your out-of-pocket costs. Your Medigap's going to cover all of this. This would be your out-of-pocket. Okay. Let's see. That was it. Really what's left is if there's any questions you want to talk about, what you think people might discuss or questions. We talked about, I guess we didn't talk about switching plans. That didn't come up in this presentation. So you can switch Medigaps. If you have, let me pull this chart up because I want to go back and answer your question. Where did I put? It's this one. All right. So on the Medigaps, if you have any plan B through N, you can switch at any time to another plan B through N. Okay. So there's not like a yearly open enrollment period like with everything else, that if you want to make changes, you do it during the yearly open enrollment period. In Washington State, once you have a Medigap, you can change to another Medigap at any time. The difference is with an A. If you have an A, you can only switch to another A. But if you have a B through N, you can switch to any other B through N at any time. So could you switch? Could you be on a high deductible and then decide like, hey, nope. Now I've decided I want to just get the regular plan G. You can switch for the next, apply for the next month, but you can switch at any time. So maybe you're feeling good, and then you find out, oh my gosh, I'm not feeling so good. I think I'm going to have some surgery. Could you switch from the high deductible to the regular? You could.
And you wouldn't have to qualify again. Is that
Nope.
correct? No.
Correct.
Okay.
Yep.
Thank you
Once
very
you
much.
have it, you have it.
Okay.
As long as you don't let it lapse.
Okay.
Yep. As long as the policies stay in force, then it's renewable, and you can switch in Washington State from one to the other at any time.
So that would even be like if you had a plan that didn't include foreign travel, but then you have the opportunity for foreign travel coming up, you could switch to Plan G if you didn't have it.
You could.
Okay. I know Washington is really unique in that way. I appreciate Washington State.
Yeah, it is. It's really unique, and it's like I can't believe they let us do it, but they do. Yep.
Wonderful. Thank you very much.
Okay, any other questions? Anything about the chart you want me to go over? Any other scenarios, situations you think about?
I just have question to Don. Don, he said that he had to went through some hard things when he get the Medigap. So I just wanna ask what made him hard to get a Medigap.
The reason it was difficult is that I had been on a Med Advantage plan for more than, I think it was within a year of turning 60. There was a time frame when you can switch from a Medigap or a Medi Advantage plan to a Medigap, and I had exceeded that time frame. So I had to find a Medigap plan that would take me with my pre-existing conditions. And once I found that plan, then I was able to switch to the plan I'm on now. Does that make sense?
Yes, thank you.
Yep.
And again, it was a SHIBA volunteer that helped me do that process. Thank you.
Yep. Yep. So, yep, that's it. If you're not in a guaranteed issue policy or time frame, you just have to keep trying and see if you can find one that will issue you the policy. But they don't have to. At that point, they can say, we don't insure anybody who has diabetes. We don't insure anybody who's had any kind of a heart condition. We don't insure anybody who's, they can pick and choose.
Hey, Linda, do you mind if I point one thing out before you go forward from the chart?
So, you want me to go back to the chart?
Yeah, if you don't mind, in that page that you were on, too.
No, I don't. I just have to find it again. Hang on. There we go.
So we had the question of what happens if someone's under 65 and they're on Medicare, and then they get that guaranteed issue when they turn 65, or if they have the high cost plan. And if you look at the United American Health Insurance, it's a great example of this. They have the age 65 and older for all of these plans that we see, right? But only the United American and the Washington State Healthcare Authority at the bottom have one for people who are under 65 on Medicare disability. So what happens is when they turn 65, they're going from the under 65 group to the 65 and older group. So they get that price, they get that change because they're actually changing the pool that they're in, the group that they're in for insurance.
Thank you, Noreen, for pointing that out. I had forgotten when that came up. So thank you.
No problem. Linda, I also found the Medigaps on the main website. So maybe when we go through, do you want me to share it now, or maybe when we go through review later?
So I am actually done. I'm going to turn it over to you anyway, because I think, yep, next is the Medicare. So I will stop sharing. If you want to share that and show us.
Yeah, and then we'll go on break.
Okay. And I appreciate that because I was sure having a hard time finding it.
Oh, I understand. That's why I did it, because I'm having a hard time finding all sorts of things on the public website. So our public website is insurance.wa.gov. Okay. And you're seeing the screen now, right?
Yes.
And it's in insurance resources for Medicare. I think you can also scroll down here and get maybe not.
I don't think so.
I guess not. So you have to know to go to insurance resources, and then we're going to Medicare. And then you have to know when you get to this page that we're going to scroll down. See how we have all these different Find Medicare resources and all the different things? If we keep scrolling down and we keep scrolling and we keep scrolling, we have the Medigap plan coverage and costs. And then, so this has a little overview of Medigap plans if you want to see it in kind of some different words and things like that. And then we have the what Medigap cover. That's just the chart that was on the last page of the price sheet that Linda was using. And that's that single chart with all the check marks. And then we have Medigap costs, and this is the price list. So when you click there, you have it. I'll share it in the chat. I think it's the same link maybe that we had before. And then we have the chart. And the last page of this is the standardized chart.
Mhm. Did you find the
That's,
booklet though?
oh, you're looking for the booklet?
The booklet. I can't find the booklet. Yeah,
I
this
thought you
page
could.
yeah, no, this is it. This is all here, but there used to be a link on this page to the booklet.
Yep, and it's not there.
It's not there.
Yep.
So you have to go to the My SHIBA in the publications to find the booklet at this point. I don't know
Yep.
why it's not there.
Yep. I think maybe because they're making changes to it.
I wondered.
Yep. Alrighty. Let's take a break. It's 2:07. Come back at 2:20. 13 minutes. There's a nice round number for you, right?
Sounds good. Thank you.
Alrighty, we're back. Linda, we have a question in the Q&A. Do you want to catch that?
Can I add a comment?
Mm-hmm.
When we're talking about changing Medigap plans, the AARP United Healthcare has been the one consistently that my clients have had the best luck with
Mm-hmm.
in terms of going from an Advantage plan to a supplemental plan. And one of the things that's in their application is they say if you say yes to certain questions and they've got the shortest list, the previous list, then do not apply and wait until you've been the medical issues are taken care of. They don't concerned about what you've had in the past. They're more concerned about what you may have pending, like joint replacement or something coming up. Whereas some of the plans will actually say, have you had any of the following in the past 5 years? And you may have had, a joint replacement 4 years ago. That should not keep you from being accepted in the future. Just based on, and I find I'd probably have 10, 15 clients trying to switch every year. Most are pretty successful.
Oh, that's good to know, Annette. Thank you.
United
Remember that.
United Healthcare is what I initially switched to.
Yeah, you only have to stay like a month or two and then you can switch to another plan that's even cheaper.
Yeah, I didn't realize that. I just waited until the next enrollment period.
Yeah. So that question in the chat. So for switching between B and N plans, does the change happen immediately or does it switch at the beginning of the next month? So when you apply the plans, it's just like everything else. It becomes effective like the next month. So you have to cancel your old plan, but you never want to cancel your current plan until you have the new plan or whatever it is you want in your hand. Don't assume it's going to happen. Don't anything, because you never want there to be a gap. So once you get the new plan or the policy that you want, then you can go back and cancel what you had. Does that make sense? Okay.
Okay, do we have any other questions about Medigaps before we move on? Okay. We're to the part of our presentation and training where we're going off script. Because when this training was developed by our fearless leader, Tim, our program manager, he had aspirations of doing a big, beautiful presentation on low income assistance. That it's just a little bit too much at this point of people's knowledge, right? And remember, we're trying to lay a foundation here, right? And this presentation is basically it's definitely it might not be putting the siding on the house, but it's definitely building walls, and we're just not quite there yet. So what we're going to do is I want you to bear with me, but what you might want to do as we do this presentation is pull out your rainbow chart. Okay, your rainbow chart is in the resources part of your binder, and it looks like a rainbow. Let me find it here.
Is this it on the OIC website at all? Because I don't have my binder yet.
Yeah, let me try to find it.
It is. You want me to try and find it?
That would be great, Linda. If you can find it and put it in the chat, that'd be fantastic. I think it's in the my SHIBA in the publication.
Yeah. Yep, I'm going there.
Okay. And we call it can you guess why we call it the rainbow chart? Because it's the colors of the rainbow. It looks like a rainbow, right? All right. So as we're going through, this is the resource that that we use. It's a job aid that we use as counselors to help people recognize that they may be eligible for assistance. Now, notice I didn't say we help them know that they're eligible for assistance or things like that, because we can't know, right? There's DSHS does applications for this program. HCA manages it, and the healthcare authority. And so there are people who get paid money to process applications and determine people's eligibility. Okay, we don't determine anyone's eligibility. So we just tell them that it seems like you may be eligible for this program, and we make the recommendations, and we may explain what the program will do for them, you know, why it's worth them applying for, but we don't tell anyone that they're eligible, and we don't do the determinations. Some of the organizations, you'll need to talk to your VC. Some of the organizations have this counselors do applications on Washington Connection. Now, you probably wouldn't be doing that at your first month in as a new counselor. It might be something that you work your way to if your organization does that. And we also have trainings and you know, recordings that you can watch for instruction on that. Some of them refer it out to the area, aging and long-term care. And maybe it's within the organization, so you're just referring it out to the other side of your own organization. You need to talk to your volunteer coordinator about how they handle that, okay? So I'm going to just take a step back here. And we're going to talk about low-income assistance. There's 3 low-income assistance programs that we help our clients with, okay? Medicaid, Medicare savings programs, and extra help. The vast majority of the help that we offer people and we screen people for is Medicare savings programs. And I'm going to make this just a little bit bigger. Forgot which browser I'm on. Can you guys see that better?
We don't see that
My share didn't go. Thank
we
you.
don't.
Thank you. I was kind of wondering because it didn't time out there. Is that better? It helps to actually hit the share button. So you're all seeing the rainbow chart with the 3 sections, right?
Yes.
Yes.
Thank you. So there's these 3 main programs: Medicaid, Medicare Savings Program, and Extra Help, that help people with Medicare and their costs. Medicaid and Medicare Savings Programs are both part of the Medicaid system, okay? Medicaid, we call these people full dual eligible. They're very low income. These are all based on the federal poverty level, so you'll see it referenced that way. They're very low income. It's $967 a month for a single person as the cap. These are up to amounts, meaning if they have income up to that, or $1,450 for a married couple. That's very little to be living on, right? So those are the people who get full Medicaid that works with their Medicare. Okay, then we have the Medicare Savings Program for incomes a little bit higher. And this is where we help a lot of people, because a lot of people who are living in this income range are used to getting by. They're just used to living on their assistance, and they haven't been able to, and maybe they have some emergency savings or things like that. And so they haven't known that they could have assistance because they knew that they were above the income level or things like that. People learn all sorts of things from word of mouth, okay? And from trying things a few years ago. So we help a lot of people with these programs. And then Extra Help is through Social Security. This helps with Part D costs by paying, it offers people 0 premium Part D plans or a reduction in Part D plans in the premium for them. And it eliminates the deductibles and it reduces the copays. So people who have Extra Help, they're going to pay a maximum copay. These are up to amounts again. For generic prescriptions, they're going to pay a maximum of $4.90 per fill. And for brand name copays, they're going to pay $12.15 maximum. So for those of you who were here yesterday when we threw that Eliquis in and we were seeing $129 copays for the Eliquis on some of the plans, that would only be $12.15 for someone with Extra Help. Okay, so we're going to take a step back. when a person has been on Medicaid and they come on to Medicare, on Medicaid, they've had full medical benefits, okay? And then they come on to Medicare and they have Medicare as their primary medical care. And then Medicaid is paying secondary. So this is primarily just extra benefits for people who are on Medicare with Medicaid, okay? But if they have these full benefits, and if they're in this very low income category, they're called full dual eligibles. And one of the reasons I'm explaining this is because if you're reading materials, you'll see things about full dual eligibles, okay? The Medicare Savings Program is also run by Apple Health Medicaid, and these are people who are only getting help with their Medicare costs. They're getting a reduction in Part B premiums. They're getting maybe their Part A premiums paid. Remember we talked about this people who have to pay Part A yesterday when Rosie was going through that, and or I can't remember who did Part A. Was that Rosie? Does it matter? It does matter. It was Rosie. So some people have to pay Part A premiums if they're eligible for QMB, meaning they meet these income requirements. Their Part A can be paid. Okay, so that means someone who may not that Medicare was out of reach for because they would have had to pay $500 and some for Part A, plus $185 for Part B. They'd have it all paid for if they're eligible for this program, and all of a sudden they have health insurance that they wouldn't have had. So this can be a big difference for people, even for the people. These two programs pay the Part B premiums each month for a client. The state actually pays Social Security for the Part B premiums. So that the $185 that's taken out of people's paychecks or their Social Security benefits, or that they were paying to get Part B, they get that back in their check because the state of Washington is paying their Part B for them. For people, when over the course of a 12-month period to have this Medicare Savings Program benefit, they're saving over $2,200 over the course of the year. That's more than a month of their income. Think of how significant that is for someone who's living on just under $1,600 or just over $1,800 a month. That's a big deal, right? And for a married couple that they're both on Medicare, we're doing that times 2. So this can make a profound difference on people's lives. Even $185 a month can be a big difference for people when it's 10% of their income or more, right? All right. So the other thing is that people who have the Medicare Savings Program automatically get extra help. Okay. When the state is paying the premiums, they're actually sending money to Social Security to pay the premiums for clients. When that happens, it triggers what's called a buy-in, and that them being eligible for the Medicare Savings Program makes them eligible for extra help. Okay, and so extra help up to the income limit for the MSPs, the Medicare Savings Program, and you'll hear them called MSPs a lot, is $1,820. That's what we're talking about here on the first part, the dark green part. If anyone is eligible for a Medicare Savings Program, we want them to try that and have that. It's helpful for them to have that because they save those Part B premiums and they get their extra help. So they don't need to have a separate application for extra help. Okay, that gets a little sticky, and I'm going to show you that in another way to look at that in just a few seconds. So then we have on the bottom of the rainbow chart, we have the other extra help. This is getting it through Social Security. Now, Social Security has resource limits, which is savings, which we also see up here on the Medicaid, okay? And resource limits are liquid savings for the most part. It doesn't count someone's house. It doesn't count their car. It doesn't count their clothing, their furniture. If maybe they have investment art, something extremely valuable for Medicaid, but not things associated with regular living. Down here you can see the resource limit is $17,600 and $35,000 for a married couple. Well, people who aren't eligible for Medicare savings program, they might have income that's a little bit higher, and they're going to be able to get extra help if their income is up to $1,976 as a single person, but they're going to be subject to the resource limit. If they have savings of more than $17,000, they're not going to get it. So extra help is a whole program when you look at it, that the limit is $1,976. But if people are eligible for the Medicare savings program, they're not going to have the resource limits. Okay. I know this is like, can you see why we kind of cut this down? Because we went like really into depth. This was going really in depth before. All right. So we have these 3 programs. The Medicare savings programs are what we help people with most. They get those through DSHS. And then they have to renew annually. And then people also have to apply for those when they start Medicare if they've been on Medicaid, because these have to do with them having Medicare. Okay. I'm going to show you another way to see this. You can see we're kind of flipping through here. Sorry. So to look at this another way, here are our Medicare savings programs, and they're all gauged on the federal poverty limit. And then that's determined, the dollar values of that are determined each year in January. So we have the first level, which is QMB, and this is the one that pays the A and B premiums if a person needs it. It also eliminates medical costs for people that are associated with Part A and Part B. So a person with QMB is not going to have any medical costs billed to them. The providers, for medical providers, have to accept what Medicare pays only. The people with this are exempt from balance billing, meaning they have no cost sharing for A and B costs. Okay, so this, you can see this is really valuable. And as a result, it's pretty well utilized in most of the counties. But SLMB, it goes from 110 to 120%. This one, it's a little less utilized because people get used to getting by on what they make. And these all had resource limits up until a couple years ago. So some of our older people who might have had, they managed to get some savings built up over the years. They might have like looked at these several years ago and they were rejected because they had savings. But now there's no resource limits. They could have $1 million in savings. And as long as they met the monthly income, they'd be able to be eligible for this. Now, people who have $1 million in savings probably don't have income of $1,500 a month. They probably have income more than that a month, right? And so that's not a normal scenario. It's more that there were about 100, I think, and Annette, maybe you remember, and I'll be honest with you, I can't remember if it was 120,000 or 220,000 people who had savings up to about $40,000 or $50,000 as a single or married person that weren't eligible for these programs became eligible for them because they removed the resource limits, and that was the biggest population that it helped. All right, so we have the people who can get these programs, and if they fall under that line in this part, we want them getting the Medicare savings program, and we refer them for that help getting one. Okay, and we explain what it does for them. And usually, honestly, we tell them that they're going to get their Part B premium back, that they're going to get that $185 back, and that's good enough. They're done. They're applying for it, right? These people are the ones that have to apply to Social Security, the ones who are above 138% up to 150%, which takes us from this limit. And this is the charts. I think that the amounts are a little bit higher. I can see that this isn't quite updated, but it takes this looks like it's last year's numbers. But these people have to apply to Social Security, and we might help them with that online. So there's the 2 basic programs that we help with for the most part. That's the Medicare savings programs and extra help. And then there's Medicaid as well. The Medicaid people would be kind of down here because they're under the 85% of the FPL. And all the people with Medicaid also qualify for Medicare savings program because this really goes, the limit for QMB actually goes up to 1401. So these people who are eligible for Medicaid for the most part fall into that QMB. Some of them might fall into the Slim B income, but it's adjusted. But when we're not going to go there, that's called the pluses. And you're going to get another opportunity to learn this. You'll get many opportunities to kind of refine this and have this soak in. What we really want you to understand as you're helping people is the rainbow chart and the limits, and that there's help for people who are making, you know, up to $1,800 that they could have their Part B payment made, or up to just over $2,400. They can get their Part B premium made if they're, you know, as a married couple.
So to
And-
apply for this, we would refer them to DHS, say?
Yeah, well, you're going to talk to your volunteer coordinator and see how they handle it. Many places we send them to the DSHS office, and that's because they can do their application and get their approval or their decline done right away. If they only have Social Security, DSHS as income, DSHS can process their applications very quickly because they have access to their Social Security records. If they have other income, then they might need verification of income. If we help them do an application on Washington Connection, it can take a little while because it has to go through processing. You know, it gets submitted and then it gets processed and handled by people. At local area agencies on aging or aging and long-term care, they might have staff that do this, and they get a tentative approval when they submit the application if it does everything. And if there's questions about it, then someone is going to reach out and help that or call that person, contact them. For us, it's more about the referral, but ask your volunteer coordinator. Okay. No, for Spokane, the volunteers don't do the applications. They send them to aging and long-term care. I'm not sure about some of the other ones. Okay. So that's the assistance programs in a nutshell. Is that there's the 3 programs. People can have all 3. Like if they're in that Medicaid program and that Medicaid income, then they're going to have a Medicare savings program and they're going to have extra help. If their income is $1,500 and that's gross, that's including the Part B premium. If their income is $1,500 and their SLMB, they're going to have the SLMB and they're going to have the extra help. Okay. If their income is $1,850, which is over the $1,820 and they're single, they're not going to be eligible for a Medicare savings program. So they're going to be eligible for extra help through Social Security by applying directly. Is everyone following that? So let's do a little exercise. Using our summary page of our rainbow chart. If someone has income of $1,200 a month and they're single, what programs are they going to be eligible for?
Medicaid.
Good try.
QMB.
Yep.
All of them.
They're going to be eligible for QMB. They wouldn't be eligible for Medicaid because their income is $1,200 a month. Okay.
Oh, I was looking at it wrong. Yeah.
It's okay. Because we have, and I kind of missed that. We have the, and because my little box that keeps popping up, the identifier is driving me crazy, quite frankly. I don't know if you're seeing that or not, but do you guys see the little box that pops up?
Yeah.
Yeah, that's driving me crazy the whole time. So the top box is the income, and then we have the resource limit. That's their savings.
Okay.
And so $1,200 is above this, but it is QMB, so they're going to get QMB. And then they're also going to get what? If they're eligible for QMB, what else do they get?
They get extra help.
They do. Yep.
Mhm.
Because anyone who falls in here is also falling into this green. It's automatic that they get automatically enrolled in extra help. Okay. So we have someone who has, it's a married couple, and they have income, combined income of $2,100 a month. What are they going to have?
SLMB.
SLMB.
Yep.
Mhm.
Is that it?
Extra help.
No, and extra
Yep.
help.
Yep,
Yeah.
exactly. Good job. Yep. Okay, we're going to do one that's a little trickier. They have income of $950 a month, but they have an inheritance. And so they have $6,000 in savings.
Okay.
QMB.
When you
and
say
extra
they,
help.
is it a married couple?
The single person.
Oh, a single
Sorry.
person.
Yep.
So
QMB.
wouldn't they be Medicaid?
But they have
they're-
$6,000 in savings.
So they have, they're beyond the resource limit.
Yeah, the
So
Exactly.
QMB
Yep.
QMB.
And
and extra help.
Extra help.
Extra help.
yep.
Yeah.
Good job. Should do one more? Or do you feel like you have it? What if they're just $900 a month in income? Just a single person, $900 a month in income. What is
And
that
all
person
three.
going to have?
Medicaid.
Medicaid,
Medicaid, QMB, yeah, Medicaid, and
QMB, and extra help.
Yep.
A lot of help.
All three.
All three of them. They're basically going to have no costs. And they're going to have some extra benefits from Medicaid. Okay. There are some special programs that people can get into, some special plans for Medicaid and for people with full Medicaid benefits and Medicare savings programs. They have access to special Medicare Advantage plans. I call them Medicare Advantage plans on steroids, and they're called DSNP plans, dual eligible special needs plans. Okay, and there's special Medicare Advantage plans. So we always try to have people get qualified before we sign them up for their plans if they have time, because it changes their options and it changes their costs and their benefits a lot. And you'll get more of that in more training. That's not foundation. That's like putting up some framework there. So we'll cover that more later. But does everyone kind of feel like they understand the 3 assistance programs? At least on a kind of a basic level, it seems like you guys are getting it. Okay. That's it. That's it for the assistance programs. So the assistance goes, just so you know, the extra help assistance goes with Part D coverage because it pays that Part D premium and deductible. I lied when I said it was out, didn't I? Because I went back to my slides and realized that there's more. But it goes with Part D coverage. On original Medicare, it goes with standalone plans, and it goes with Medicare Advantage plans for the Part D coverage. They still apply. If there's a drug premium on the Medicare Advantage plan, it will get reduced. And if there's a deductible, it'll get paid, it'll get eliminated by the extra help. So, and someone with QMB wouldn't have cost sharing for A and B. So the benefits do get applied to those coverages. Can you guys see me scrolling through slides here? We've just skipped about 45 slides, I think. Are we good with this? Hope is good with it. Thank you, Hope.
Yeah.
I love having people who are mood indicators for me and that they can tell me if there's something wrong. So one of the things that, and I'm just going to touch on this, okay? But one of the things that happens is that Medicaid programs, that full Medicaid, right, that we were talking about, and I think I just closed it by accident, darn it. On the rainbow chart, that full Medicaid, when people have that, it has what's called estate recapture on it. And that means that if people, Annette, I'm gonna mute you, okay, if you don't mind, okay? And so you'll need to unmute if you want to talk. But it has a state recapture on it. And what that is if people use Medicaid benefits, and they have resources through their estate. So, you know, they own a home and things like that. When their estate is settled through either their own passing or that of their spouse, and there's a few other limited people that it can be passed on to, like a dependent with disabilities or things like that. When the estate is dissolved, the person's Medicaid benefits that they have used, the costs that Medicaid has paid on their behalf, can be recouped from the estate. Now, for people with only Medicare and Medicaid, that they're using their Medicaid as a backup for Medicare, there's very little cost because most of the costs are paid by the Medicare savings program, right? So Medicaid really doesn't have very many costs that are in as part of their coverage. And is everyone following around? Because remember, the Medicare savings program for someone with Medicaid, the Medicare savings program is paying the premiums, and it's eliminating the A and B costs for most people with Medicaid, right? So they don't have any of those. So it's extremely little, but there's people on Medicaid who have assisted living. They're in assisted living. It might cost $4,000 a month to be in assisted living, and they only have $1,500 a month in income. So they're allowed to keep a small portion of their income. And for easy math, we're going to say that they have $1,600 in income, and they're allowed to keep $100 of it. Okay, because I like easy math. I wasn't one of Annette's students, so I need easy math. And we have $4,000 a month for their assisted living, and they have $1,500 of their income that can go towards that. It's still a $2,500 deficit. They're still $2,500 short on their monthly payment for assisted living. Let's say they're there for 10 months so that I can still do the math. It's $2,500 times 10, $25,000. And then they pass away, that $25,000 would be charged to their estate. So some people get concerned about applying for Medicaid. And this is like one of the things that we help people with to some extent, not very much, because there's people at DSHS and HCA who are paid to explain that to people, right? But we want to assure them that, first of all, the Medicare savings programs don't have estate recovery, which that's where most of their benefits are coming from, is the Medicare savings program from Medicaid. And extra help isn't a Medicaid program, it's Social Security. So that's not covered, that's not subject to estate recovery either. It's only that Medicaid, and it tends to be a very, very small amount. Okay, do we have any questions about that? Do you guys want to do any more practice on income or all right. So what are some of the questions that you think that clients might bring you as a volunteer advisor? Anyone? Bueller?
Well, I can imagine, since there's not many provider offices that will A, accept Medicare, and B, Medicare with Medicaid, I can imagine people are concerned about losing their doctor if they're on a Medicare, Medicaid type plan, because there are limits, and there are not many, at least in this county, there's not many providers that are accepting Medicare, period, just plain Medicare. They'll do Medicare Advantage, but not Medicare.
Yeah, we're seeing a little bit. What county are you in, Hope?
Clark.
Okay. Yep, we're seeing more and more of that providers are in network for the companies like United Healthcare or things like that, right? But they're not accepting original Medicare.
Right.
Yep. So then the MA plans, the dual eligible special needs plans tend to be a little bit more effective for those. They also, because they're Medicare Advantage plans, they also include dental, vision, hearing, things like that. And they're more robust than the ones that are available to the common market. They include over-the-counter allowances and things like that. Even for people who are partial dual eligibles that have those Medicare savings programs only, that's a way that they can get dental, vision, and hearing coverage and fitness benefits and all sorts of good stuff, actually. So as long as they can get their providers and get access, like out on the islands and things like that. And I live over in Spokane, and I support the program in Clarkston, and they're 100 miles from Spokane, and they're 50 miles from Pullman, like the next hospital. And it can be very, very hard for those people to find providers and get services just because they're isolated. And that's a typical thing with all of the Medicare Advantage plans in the more rural areas.
Mm-hmm. Well, that's what I said yesterday with my mom who lived in Squim. She couldn't have a Medicare Advantage. And she did a lot of her primary care was in Squim, but then her specialty doctors were at Virginia Mason in Seattle. So that created all kinds of issues. But I chose my Medicare Advantage plan because I have over-the-counter coverage, $75 every quarter I get put on a card. So that helps with my over-the-counter, like my vitamins and stuff. And then I have dental and I have hearing and exercise. Those are things that you're not going to find in traditional Medicare.
Right, exactly. All right. Do we have any other questions, or do you guys just feel like you don't know what you just don't know what to ask at this point?
Quick question.
Yeah.
It seems to me that when I think about sitting there with a client, the main questions would be about income. Are we allowed to share this helpful Medicare rainbow chart? Just give it to clients so they know?
No, that's a job aid. So any of the job aids are for us. You can show it to them, what you're using, but it's written for someone who has an understanding of the programs and the benefits that they're talking about. Someone who isn't familiar with it might be really confused, and then they might misinterpret and feel like they got bad advice. So that's not, but there are pages on Medicare.gov and things like that that have good explanations of the assistance programs too. And the Medicare Savings Program, it's run by the state Medicaid program, but it works the same across the country. It's just that the income levels are a little bit higher in Washington than they are in some of the other states. Like our QMB goes up to 120% of the FPL. The national standard is 110%. They raised that in Washington last year. And then the top limit for the MSPs, for the Medicare Savings Programs, in the federal standard is 135% of the federal poverty level. And Washington raised it to 138%, which is nice because that's the same income level for people with Magi Medicaid, the people who are under 65 that got Medicaid through the expansion. And we used to have a little bit of a gap for some of the people who were at the top of that income level. And now all of those people who had basically everything paid for under Magi Medicaid now have at least the Medicare Savings Program where they're not having to pay the Part B. But those are differences for Washington. The no resources for the Medicare Savings Program, most of the states have resource limits. And I think I told you guys that I worked in Idaho for a long time, so I have friends there, and we kind of talk about this. And there's 13 or 14, well, I think it's 13 plus the District of Columbia that have waived the resource limits. Out of the 54, states and territories that have Medicare. So it's just a small portion that have waived those resource limits. So when we go on to the plan finder and things like that, we kind of have to adjust, because remember, when you're looking at things on Medicare.gov, it's federal. They're talking about at a federal level, not necessarily the state level.
And do these amounts on the rainbow chart change every year? Because I noticed what you showed us is slightly higher than what's in our workbook.
Yeah, they change every April. April 1st, they take up the new amounts take effect. And there's a guide that we'll share with you in some of the future training that HCA does. It's an eligibility overview, and you can share that with people. And what I do is sometimes if I'm helping someone and I'm sending them an email, I'll just take a screenshot of that page and then send it to them. You know, the one with the Medicare Savings Program, and it has the income levels and things like that. So we do have some resources. We do have resources that you can share with people, just not the rainbow chart. That's all.
Thank you.
You're welcome. All right. Anything else? Anyone else?
Noreen, I'd like to add a comment. I just
Sure.
recently helped a client who had been medically needy, but her ex-spouse died, and so they upped her Social Security income. And I had to help her deal with the fact that she was losing some of her benefits because she no longer was medically needy. And it was like, to her, it was a major trauma because she liked the dental benefits and she liked the other things.
Mm-hmm.
And it was, we were able to pair her up with some providers in our area that are willing to accept a very limited number of low-income patients for modest fees, usually $5, $10. So they have something on their book. But yeah, it's something that is happening more and more now that Social Security is automatically upping a lot of people when their ex-spouse dies, that they're drawing benefits on.
Yeah, it does it because it changes people's eligibility when their income changes.
Mm-hmm.
So yep, that's a very real thing.
Oftentimes they don't know. All of a sudden they get more money and they don't know what's going on.
Yep. I had a couple of people ask me, like, can I just give my $60 a month back? Because it was like $60 a month that they were becoming ineligible for things and losing $2,000 a year of benefits. You know, they were losing $125 worth of benefits every month. It's can I just give Social Security the $60 back? I'd rather not have it. And our answer for that is you would have to talk to Social Security about that. And if you're trying to help someone with low income assistance, it's okay to say, you know what, I'm not quite sure about that. So I'm going to check with my supervisor, or I'm going to check with another volunteer who's been here, who's more familiar with this, and I will get back to you. We do that all the time, okay? Even, I mean, we still do it when we've been doing this a long time, when there's like these little nitty things that we have to check into. And people are generally so grateful to get the help, and they'd rather know that they're getting correct help, that they're really happy to say, yes, of course, please get the right answer. Don't just be making stuff up because you think it's what I want to hear, right? They don't want that. They want the right answer. So it's totally okay to say, you know what, I'm not sure, and I'll get back to you, or I'll ask my supervisor to have someone else call you and follow up on this. Okay. That's always a good answer. Always, always, always. So.
One of the things I also say with clients is that it looks like you might qualify. So let's apply. And what's the worst thing that could happen if you don't qualify? You're not going to be any worse off.
Yep. Yep.
And
I say
at that point that they're more willing to apply and reach out.
Yeah, especially if they're in the boundary. And I do that same thing in that. It's like, you know what? If they say no, you are exactly where you are right now. So all we can do is like have it improve, right? It's not going to get any worse than where you're at right now. It's not going to make anything worse. So let's just do the application and see. Because there's also like some little, and our amounts include, there's called a $20 oh my gosh, Annette, what's the word I'm looking for? Right, or one of my people who've been doing assistance before.
It's
Disregard.
income disregard.
Disregard. Yep. Thank you. I was having a little brain fart there. Thanks, Shannon. So there's a $20 income disregard, meaning that they take $20 off, but we have that included in the amount. So, and we don't want to get too confusing here, but there's all sorts of little nuances. So we send people to where they have the real answers. We don't want to guess. And that's how it is with anything with counseling. All right. so I think if I'm not mistaken, and one of my coworkers can correct me if I'm wrong, we're to our wrap up part of the day where we're going to kind of go through some of the things that we've talked about. And if we want at the end, we can go back into the plan finder and look at that. If we still have some more time, or just get out of school early today. So let's take a break. And should we take another break until 3:20? Or is that too long? Do we want to do 3:15? I see Norma, and she's the first to shake and most prominent in my view. And she's saying 3:20, right?
Yes, 3:20 is great.
3:20 it is. 14 minutes. Be there. Aloha. Annette, thank you so much for sharing.
Oh, you're welcome. I love the
Yeah.
dog in your background of your screen. Is
Thank
that your
you.
own dog?
That's my Livy. Her name's Livy. It's really like her full name's Olivia, but it was too much to say Olivia or Olivia. So it's Livy, Livvy.
Beautiful animal.
Thanks.
Yeah, I was gonna say that too. I like your background. And I
Yeah.
think you changed your other picture in your profile somewhere too. I like that one too, like on a ferry.
Yeah.
Yeah.
Yeah, I was on the ferry in Canada. About once a year I take Livy up to Nelson, BC. And because she likes to look at all the they have a lot of murals there, and it's only a couple hours from here. And they have a lot of murals, and so she likes to go look at the murals and smell all the smells in Nelson, and then we go ride the ferry and take the scenic tour home. And yeah, so that's what the other picture is from. But yeah, I took this one about 2 weeks ago. That's the park in my backyard.
Oh wow.
Yeah.
It almost looks like, an online, it looks so good.
Yeah, it looks like it's like one of those fake ones that I usually have on, doesn't it? Yeah.
All right. Well, it's walk o'clock for me, so I'm gonna go around the block. I'll be back.
Yep. I'm gonna set the timer for 12 minutes.
So Noreen,
Yes.
I created a couple of quizzes, but I don't remember how to get them into the
So go into the oops, hold on a second. Go into the more, the three dots, and you should see polls.
on
the command bar, you're going to do the three dots, and then you'll see polls, and you click on that. And then here, let me change my screen share to the one that or I'll bring this over there. What am I thinking about? So you should get this screen when you click on the more and you have polls. Otherwise, you might have a separate polls command on the bottom of your thing.
Yeah, under the host it says, or wait, nope, there's polls quizzes across the bottom. Yeah.
Yep. So hit polls, hit that one, and then you should get this.
I don't think the timer started, by the way.
Thank you, Kendra. I do that all the time.
It occurred to me, I was like, it's been 12 minutes for a while.
Yeah.
Thanks.
I don't see your screen. I don't see what I'm supposed to get.
Okay, hold on just a second. Let me stop share.
And side note on the quizzes, I think there's 2 Medicare Advantage ones because Shannon and I each created one. So it's okay. We can just pick one or do both. It doesn't matter.
Okay.
They both have 3 questions. So
we're all doing our own sections, right?
Okay. Yeah, that works too.
But I don't know how to get them in there.
So Linda, so what you do, can you see my screen now?
Nope.
Okay, because I forgot to hit share again. I love when I do this. Okay, so you can see it now, right?
Yes.
Okay. So when you hit polls, you should get this list.
Nope.
You seeing this list?
Nope, I see the clock.
You're not seeing the list of polls and quizzes that I have on my screen right now?
No, ma'am.
You must not be able to. Do you have a list of polls and quizzes in a white box?
Yes.
Okay, up in the top right-hand corner of the white box, and all the polls and quizzes have stars by them. There's a plus sign up
Uh-huh.
above that column. Hit the plus sign,
Uh-huh.
and then the untitled poll 7.
Uh-huh.
You can add your name in there, like for your section.
So like the one that I created. So if I put BT Medigap, put that in there.
Yep.
Okay. Oh, so I have to put it in here, not in the one that
Yeah.
I did. Oh, because I made one in my Zoom thing, but it's okay. I got it. So I actually have to re-put it in here. All
Right.
right.
It has to be in the it either has to be in the meeting or in the library. And but this is on Shannon, so we need it to be in the meeting for this one.
Okay, because yeah, it's like, how do I get it in there? Because it's not my. Got
No,
it.
you have to type them in. But you can control control V to control C to copy, control V to paste.
Got it.
You can't like right click, left click in Zoom. But
Okay.
you can copy and paste using the control buttons.
Okay. So I'll redo mine. Okay. Thank you.
Yep. Okay, what's going on with our timer here? 8. All right. Welcome back. We're on the home stretch. Crowd goes wild. All right. Linda, you got us started oh so long ago. When we started this training last year. I mean Tuesday.
Tuesday. Today, actually, I think I got it started Tuesday. I got it started Wednesday. I got it started today.
I think you did. So why don't you start our review too?
Yeah. So, yeah, are we back?
We're back.
We have everybody. So, as far as the sections, I think the overview was the first section. So do we want to start there, or you want me to just jump in and do the review of mine? I'm happy to do that.
No, we can start with the overview. I just thought maybe we just kind of want to talk a little bit about counseling. And just remember like some of the key points that we don't recommend agents or companies, right? Ever.
Ever, right?
Yeah. We can't do that. We just can't do that. And we're really grateful for all of you being here. So let's talk a little bit about, oops, I'm sorry. Let's talk a little bit about Medicare. And,
there is a message in the chat box that's very interesting.
Yeah, I saw that. And you know what, I think, Rosie, check out the chat because you did part B, right? And you're going to be talking about
No,
part
I did B.
Oh, you did B? So check out the chat, Linda, because I think this really has to do with part B, the part B penalty. Sorry, I'm getting my slide deck up just really quick.
Yeah, I don't, so the question, so I'm reading the question. It says, I have another question. A few years ago, I arranged for an Advantage Plan broker to come into the church I attended and talk with, I think, whoever had questions. One man said he could not afford to sign up for Medicare, that he was financially penalized. Is that because he did not have a qualified prescription drug plan, a Plan D? Do I understand that correctly? So, I suppose it's possible, but there's also a Part B penalty if you don't sign up for Part B when you are first eligible. So, if the longer you wait, the larger that penalty is too. And of course, that never goes away unless, of course, you qualify for MSP. If you actually qualify for assistance, then the state is paying your Part B premium for you, and the penalty goes away. But then, of course, if they can't afford to pay their premium, right, then we should probably be looking at, do they qualify for some extra help? So that makes sense? Yeah.
All righty. Sorry. I'm just getting set here a little bit. So after Linda kicked us off with our introductions and we shared, then we did an overview of Medicare. And are you seeing my screen right now? No, right?
No, nope.
Okay. And we talked about 423. There's 4 systems. I'm sorry, that there's 4 parts, 2 systems, and 3 ways to get plans, right? So what are just go ahead and shout it out. What are the 4 parts of Medicare?
A,
A,
B,
B.
D, and C.
Yep. Exactly. Whoops, sorry, hold on just a second. And then we have the 2 systems, right? What are those called?
Original
Medicare.
Medicare and Medicare
Medicare
Advantage.
Right. And then how might people, what's the 3 for? Does everyone remember what the 3's for?
I'm sorry, you said 3?
Uh-huh. There's, it's actually
Oh, the 3
not,
markets?
yep, exactly. The 3 markets, the 3 ways people might get plans. And what were those?
Medigap, Part D, and Medicare Advantage.
Pretty close. But it's like where it's
Sure,
more
okay, commercial,
uh-huh.
employee group, and Medicaid then.
Perfect.
I'm guessing.
Yep, that's it. Nope, that's
good.
it. That's exactly it. All right, good job. So now we're going to have you all, as soon as I get it open again. Where do they go? Linda, I need you to save your poll. Oh, no, no, never mind. That was me. Sorry. It was me. Sorry. From trying to show you. All right. So we're going to put a poll up. And you guys are, you should see it on your screen. Is everyone seeing it? And we want you to answer the questions.
Oh, yep.
These are the main points for this section. And they have, some of them are choose all that are correct, that it has more than one option if it says multiple choice.
A, B, and D.
Are we supposed to check them or just
Yeah,
verbally?
no,
Oh.
you click the boxes for the answers.
Okay.
Yep, and you can do more than one. If it's when it's multiple choice, it has more than that. You have more than one choice.
What's number 4? Untitled question.
Oh, that's the 4 and 5 are a miss. Oh my goodness, and 6, all of those are just take a choice. Just hit 1 or 2, and because it won't let you go back. I'm so sorry. I must I went through and deleted those, but I must not have saved it with them deleted. I must have forgotten to resave. So just click 1 or 2. You're not going to get those wrong, and then we'll do number 7. I always want to do the Jeopardy music for this. Do, 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 do.
Does number 3 really mean medical coverage, or is it Medicaid? Is it really Medicare coverage?
Medicaid.
But Medicaid's not Medicare coverage. That's my problem.
Mm-hmm.
So what's the question?
What are the 3 ways people might get Medicare coverage beyond Part A and B? There's 3 ways that they can get those plans that are once they have their A and B, there's 3 ways that they can get those plans that provide the extra coverage.
But right, that's the thing. They're plans that give extra coverage, not Medicare coverage.
And that's what we're talking about, beyond Parts A and B, like the coverage beyond Parts A and B. So the 3 markets that we were talking about.
Yeah, the question's just worded weird, I think.
And for number 4, it's set untitled question.
Yeah, just hit one of the choices. That's a mistake. I deleted all those, but I must not have saved it. I must not have saved it with the changes. So it looks like I have like 4, 5, and 6 that I did that with, that it didn't save the deletions. And so it went all the way down to 7. It was really only supposed to have 4 questions. This is what happens when I try to do things and I'm on the phone at the same time. Okay, how are we doing? Is everyone seeing this? Like most,
I
with
don't
most
see
of the,
anything but you and your doggy.
really? You're not seeing the poll?
Uh-uh.
Not anymore.
I completed the
It-
poll.
Okay,
But
if you
I-
completed it, then that's why.
Yeah, okay.
Yep, okay. Okay, it looks like we have everyone except for the staff now, so I'm gonna end it. And we'll share the results. And don't worry, see it. All right, so now you guys can all see that we're sharing the results, right? Which of these choices are parts of Medicare? And it's part A and part B and part D. Part N isn't a part. That's one of the Medigap plans, though, but it's not one of the parts. Okay.
If it's a Medigap, I'm sorry, if it's a Medigap plan, isn't it called Plan N?
Uh-huh, it is. Yep.
Okay.
That was just in there to be there, to have something else. Which of the following people might be or is eligible for Medicare? A U.S. citizen, age 65 or older? Yes, that's right. A legal permanent resident, age 65 or older? That's correct too. An undocumented Canadian, age 65 or older? No. Good job. 100% accuracy on that one. Good. 3 ways people might get Medicare coverage beyond parts A and B. So we're on that chart of they have their A and B and what else might they get. And all 3 answers were correct on this, that they'd get it. It's those 3 markets that we just talked about, right? And Medicaid is one of the sources from the government for getting that. We're skipping 4, 5, and 6 because those were mistakes. And then a person choosing to use their Part A and B as issued and a Medicare Supplement Medigap plan is choosing which system or way to use their Medicare benefits, and that's original Medicare. So good job. Everyone got them all right. So we're good. Okay. What's next?
I think next is eligibility and enrollment. So how do I get to the screen that comes up with all the polls?
Click on the polls and quizzes.
Yeah, I just get your box. Okay, let me try it again. Let's see. Nope.
Try it
Just
again.
Okay.
Sometimes there's a delay. Like I clicked the back and sometimes there's a little bit of a delay for because it's going to San Francisco to tell it to go back that we finished that one.
Okay, let's see. No.
Okay. Do
Well,
you want me to launch it?
yeah. Oh, there we go. Okay. So number 1, which federal agency is responsible for managing eligibility and enrollment?
Did you get it to launch, Shannon?
Oh, I thought you did because it came up.
Okay. Oh, yeah, we just weren't getting any. Didn't have any. So I was kind of wondering. I thought maybe you got it to launch, so I wasn't seeing any. But now we're getting it. Now we're getting responses. Yeah, it registers after you've done all of the. After people have entered all the answers, that's when it registers. So
It's
like nobody's answering.
exactly. So I thought, well, maybe Shannon got it to launch at the same time.
Oh, there we go.
Okay. Is everyone done? All right. Okay, so there we go. Cool. So which federal agency is responsible for managing eligibility and enrollment? It's not the IRS. It is actually not the Center for Medicaid and Medicare Services. And it's not Homeland Security. So if you pick Social Security Administration, you are correct. And it's just the eligibility and enrollment. The Center for Medicare and Medicaid Services is the federal agency that operates and manages Medicare and all the plans, and for original Medicare, the billing and all of those things, but they don't actually manage eligibility and enrollment. So that's kind of confusing sometimes. Okay, number 2, who gets automatically enrolled into Medicare? And you are all correct. Those who are already receiving their monthly Social Security benefit. And then what does IEP stand for in Medicare? And number 1 was correct, initial enrollment period. It's the, initial enrollment period. And then which of the following is not a condition for eligibility for Medicare? So you do not have to be collecting Social Security benefits to be able to enroll in Medicare, but you do need to be a US citizen or permanent resident or 65 or more years old or under 65 with a disability. So any questions? All right. You guys are doing awesome. So I'm going to close this. Kendra has her hand up.
I did. I just wanted to say Ben had a great question in chat about the Part B penalty. And his follow-on question was, with the cap, does it exist? Okay, so let's see. Does a cap exist for the penalty? Meaning after a certain percentage, the penalty, there will be no further increase, because the cap is on Part B, I believe, 10% a year. So every year it's, 10, then 20, then 30. Is there a cap on that?
I don't think so.
Yeah, I've never heard of one.
Yeah.
It can just keep accumulating forever and ever.
I have a client who is looking at it, and it was going to be 140% for her because she has not signed up, so there's no cap.
Yep. Yeah, not aware of a cap.
So let me make sure I understand that correct. So the first year it's 10%, the second year is 20, the third year is 40.
30.
Or is it just 10% for the, I'm not sure.
10% times the number of years.
Okay. All right, that makes sense. Thank you.
For 12-month period. Yeah. Yeah, that's steep. 140% penalty sounds pretty bad.
And Norma had a comment or question, would extra help be available to help? So not for a Part B penalty. If the client was able to be eligible for and enroll in an MSP, then however much the penalty got up to would be waived. And that would be permanently waived, not waived for while they were on the MSP, but permanently waived forever and ever.
All right. I think I'm next with the quiz. I feel like it disappeared though. Hold on. Oh, found it. Hopefully you all can see this. There are 4 questions. The first one being, Medicare Part A primarily covers inpatient hospital stay, skilled nursing facility care, hospice care, and some home health care. True or false? I think there is a delay because I'm not seeing any answers either. No one wants to do my Part A quiz or poll. Oh, there we go. Thank you, Linda. No. We'll give it another minute here. Looks like folks are still answering the question. All right, I think that is everyone. Thank you so much. All right, so I will end the poll. Someone feel free to shout out if you haven't finished yet. Otherwise, I'm ending now. And I'm going to share the results. Can you see the results? Okay, thanks. All right, so question number 1, Medicare Part A primarily covers inpatient hospital stays, skilled nursing facility care, hospice care, and some home health care. That is true. Question number 2, Medicare Part A is part of which system of care? Is it part of original Medicare, Medicare Advantage, or both? Can it be included in, which one is it included in? And yes, the answer is both. Part A consists of original, A and B is original Medicare, and then the D. A and B, or no, A is also, A and B is also an original. Medicare Advantage. I'm losing my train of thought here. The question number 3, can a person who doesn't have enough work credits of their own use their spouse's work history to qualify for premium Part A, assuming that the spouse has 40 plus quarters of work credit? And the answer is yes. They can qualify if they do not have enough of their own, but their spouse does. And number 4 was a little bit of a case sample. Vivian is single and has acquired only 35 quarters for Medicare. Therefore, she doesn't qualify for premium free Part A. Vivian will have to pay a premium of $285 every month. So that's the price for 2025, or the premium in 2025. in order for her to get Part A. So can Vivian continue to earn more work credits? And the answer is yes. So she decides to go back to work and then earns, and at the end of that second work period has more than 40 work credits, then she would qualify for premium free Part A. Very good.
Didn't stop sharing.
Yep. Did it not stop yet?
No, I hit it. I wasn't sure. Okay.
Um,
So do you have another
Question-
one or is it mine?
No, a question on 3. I think there's really, I answered yes, but I think actually it depends, because if for spousal benefits, they have to have been married at least 9 months. Otherwise, it doesn't count.
mhm.
So that could be, I know the intent was to say yes, but if somebody's really familiar with how it works, then it depends would be the correct answer. And so need to maybe next time clarify the question better.
Thanks.
I have a question. The last question about the woman who didn't have enough quarters of work to qualify, would she have to sign up for Part A and pay the penalty? And then as she accumulated enough quarters, would that go away? Does that make sense?
Yeah, so if she's married and her spouse qualifies for the premium free Part A, then she
No,
would.
it's the last one when she was single. And she
Oh,
only had
Vivian
35.
example?
She had 35 quarters of work experience. And the question was, can she keep working?
Mhm.
Does she wait to sign up, or does she sign up now and pay the higher premium?
Well, they
Either.
also didn't say how old she was, I noticed in that one. So if she was, eligible, but not, if there were no penalties, that could also come into play, I think.
Yeah, I didn't specify the age on that one. So I think it would depend, but depending on that, and then I don't remember, I don't have the full, I'd have to bring it back up again.
If she wants Part A, she would need to pay for Part A, but she doesn't have to have Part A, right?
Right.
That's right, Shannon.
Right.
But if she was to keep working, once she accumulated 40 quarters, how do you deal with that? If you're 65 and don't have 40 quarters, do you sign up for Part A now or do you wait?
It would need to be up to the client whether or not they wanted that hospital insurance. They would have
Well-
to make that decision.
Yeah, a lot of people wait. They'll wait to add their Part B. I mean, their Part A, I'm sorry.
Okay, so you don't have to, it's not like Part B. If you don't sign up, you get a penalty.
Right, that's a good point to bring up, because Part A, and I'm sorry, I'm not trying to take over, but I actually know the answer to this. So there aren't any penalties for not signing up for Part A. So she wouldn't be penalized if she did not
Okay.
sign up.
Thank you.
If she had enough qualifying work credits.
Okay. Are we ready for the next one?
Yeah.
Okay. Okay. Just 2 questions. And this is kind of a Part A, B combo.
No pull yet.
And here they come. I know, it's so impatient.
Question 2 is tricky.
It is, oh,
Just
you know
saying.
what? It's supposed to be a multiple choice. And
Oh, well,
and not a
I only
single
answered
choice.
one.
So sorry, it was supposed to be multiple choice. I had to transfer the question from somewhere else in here, and it should be a multiple choice. So I'm sorry about that.
I tried to do multiple. It won't let you.
It probably won't
Yeah.
it probably won't because I didn't mark it. It was supposed to be a multiple choice. So
Linda, did I accidentally end your poll? I didn't mean to.
it doesn't matter. It's okay. We'll just go over it. We're close. So so sorry about that, guys. Thanks for bringing it up. So question number 1, what parts of Medicare are known as original Medicare?
A and B.
A and B.
Yep, that's right. A and B. And then question number 2, which is supposed to be multiple choice, what does part B cover?
Outpatient care and durable medical equipment. I think I can't remember the other 2, but I know I could only pick one. I tried to pick more than one.
Yeah, yes. So it's oh, are we not sharing the results? There we go. Now are we sharing?
Yeah.
Okay, sorry about that, guys. So yeah, so basically you guys got it right because you picked everything but inpatient hospital care, and that was the correct answer, everything but inpatient hospital care. So thanks for that, guys. And moving on. I think that's part D.
Yeah.
Okay. Noreen, you might have to launch the I don't know why I can't get my polls to launch.
Okay. It's part D next, right?
Mm-hmm.
Okay.
Oh, then it's not even my turn yet.
Nope, it's mine. And so you should be seeing the poll. Everyone seeing it? Oh, good. And I don't have extra questions. Remember to save that one after I made the changes.
I like the last question on number 3, the one of the answers.
We get it?
I think we have one more. We have one. There we
Okay.
go. All right. So what does Medicare Part D cover? This was actually, I worded this badly, honestly. But this was a little bit tricky because it's primarily prescription drugs purchased at a pharmacy. But if you've done a lot of reading, you'll see that sometimes the medications administered in hospitals or things like that would be Part B. So it could be both of the above as well. This is kind of an exception that we're building the foundation here. And so we basically talked about the prescription drugs purchased at a pharmacy. Most of the medications that are administered in hospitals or clinics and shots are Part B, like boy, but sometimes it's Part D for those standard drugs. They'll, like if someone's in the hospitalized and they're taking their high blood pressure medicine and their atorvastatin, their high cholesterol medicine, those kinds of things, they'll bill Part D for those. When can a person enroll in a Part D plan? And the answers were all of the answers. That's correct. The copays for prescriptions may change throughout the year depending on the weather. You all got that wrong. No, I'm just kidding. It's all of them except the weather. So good job. And I didn't, yeah, there we go.
Given the way prices and pharmacies have changed in my area, the weather makes a lot more sense.
I know that, and that's kind of what I felt like. It's like it feels like it changes with the weather. All right.
Okay.
I think you're up, Shannon.
Okay. I just can't, I don't know why I'm not getting to the, I just get the last box that was shown.
Do you want me to launch? Which one is yours? The MA plans or the basic training MA plans?
The MA plans is mine.
Okay.
All right, there's just 3 questions.
Yep.
And I think they're all true and false.
And Shannon, if you hover over the quiz or the polls, well, I'll tell you later. Never mind.
Okay.
True, false. Yes, no.
Mm-hmm.
Okay. I see 12. I'll end it. Oh, 13. Well, we've got a newbie. Okay, I'm going to end the poll.
Yeah, I was going to say we've been cutting it short. I never counted this. I never counted our squares. How many Hollywood squares we had today?
That's okay. All right. And share the results. There you go.
All right. So number 1, you must have Part A and Part B to get a Medicare Advantage plan. And you all got that right. That is true. Number 2, Medicare Advantage plan enrollees can elect a standalone Part D plan. That is false. And I maybe could have written this question a little bit clearer, but remember on our paths chart, we had one side and the other side. So when you're in original Medicare, you need to select a standalone Part D plan to go with your original Medicare to have drug coverage. If you're going the Medicare Advantage plan route and you want drug coverage, you have to get a Medicare Advantage plan that includes that drug coverage. So this is part of the not being able to mix and match. And then number 3, does original Medicare cover vision, dental, and hearing? And 100% no. Good job, everyone.
We should have timed our review, guys.
Yeah. I know it's
yeah.
too so long.
Wow.
We only have a couple left.
Fun.
Rosie, do you want to do
yours?
If you have to leave, you
Feel
can.
free.
But yeah.
No, let's just go on to the Medigap and
You want me to do the Medigap?
Yeah.
Okay. It's only 2. There you go. 2 questions on the Medigap. Okay, so it looks like we're close. Okay. I will end the poll and share the results. Okay, so which parts of Medicare do Medigaps help cover? And it is A and B. The Medigap covers the gaps in the coverage from what Medicare Part A or Medicare does not cover in Part A and Part B. Medicaps do not cover prescription drugs. Then question number 2, when is the best time for a client to enroll in a Medigap? And the answer we're looking for is within the first 6 months that they are 65 or older and have Part A and B. It's when they get their guaranteed issue period, that once in a lifetime 6-month period where they cannot be denied a Medigap. Okay. And
Okay.
yep, I think you're it.
Okay, let's get the assistance. I think there's 3 questions. Yep, there's 3 questions.
And if people are still fired up with the polls, I can do the last Medigap one. I mean the Medicare Advantage one.
Okay. Yeah.
If you're having fun, we'll give you the bonus one.
This is so much quieter than our quick fire rounds.
Yeah. It takes so
where we have all
long.
the squares lit up.
Yeah, it takes a long time for these things to come through. I don't remember it taking so long in the past.
Yeah. Sometimes the poll results, like Zoom is based out of San Francisco. So when people enter, it gets transmitted from them to San Francisco and then back to the event, right? On into the event, and then we get it back again. So it can be kind of delays. And then on this one, on number 2, I just gave a lot of options. So people are actually reading it and choosing their answers. So that's good. I basically gave the whole low-income assistance spiel in the quiz here. We have 1 or 2 more, or have we had? It looks like we had some people leave. So, has everyone had a chance to answer?
Yes.
Okay,
Yeah.
thank you. There we go. Okay, I'll end it now. So the State of Washington program that pays the Part B premiums for clients is called Medicare Savings Program. Extra Help is through Social Security, and that's for the Part D coverage for the prescription drug assistance. Which of these are true about Medicare savings programs, and it was all of them. There are 3 levels of assistance. With QMB, the state's going to pay the A and B premiums, and the client can't be billed. That's a big benefit of that one. All levels of the MSP pay the Part B premiums. And then a person who gets it is automatically qualified and enrolled in extra help. Good job. It looks like you guys got that really clear. And these were like the 2 main points that we wanted to make sure. And it doesn't have resource or savings limits. And then for extra help, it reduces prescription drug costs. It has resource limits for people who do not have a Medicare savings program, and it's applied to both standalone Part D plans and Medicare Advantage plans. So, and it does, it does, oops, nope, I scrolled up, yep, that's it.
And I just want to share, everyone, that, you know, the MSP, QMB, SLMB, extra help, you know, in the beginning made my head spin around and around and trying to follow the conversations. And even if she talks slow, I could not track. So, but I promise it gets easier. Pretty soon you start to remember, okay, MSP is these 3 things, and this is Medicaid, and this is, so I know it's hard, but it'll get easier. So just as you read it, you go over it, pretty soon, you know, you understand it as fast as she can say it. So
yep, everyone has light bulb moments with the low income assistance programs where you're like, you're kind of sitting there going, oh gosh, and then all of a sudden it's like, oh, I get it.
Yeah.
It's usually like the 3rd or 4th time that you're going through it, or you're like looking at it and just kind of trying to do it right. You go,
and it does. It does take a while, but eventually.
yeah. And Kendra just made that point. There's so many acronyms, right? So many acronyms.
So,
all righty. Do you guys want the last one? Do you want Rosie's?
Totally okay if you don't, but I double checked. They're straightforward, so no.
Okay.
No leading down paths of.
Yeah.
All right. Here.
Watch away.
Oops, wrong button. Here we go. I think we have about everyone. I'll go ahead and end. Yes, Shannon?
Oh, that was a mistake.
No.
Sorry.
All right. Question number 1, Medicare Advantage plans always include Part D. The answer is false. Not all Medicare Advantage plans include Part D. Question number 2, if you join a Medicare Advantage plan, you can buy a Medigap to go with it. Answer is false again. You cannot buy a Medigap if you're on a Medicare Advantage plan, only if you're on an original Medicare. And question number 3, when is the Medicare Advantage open enrollment period? Is it October 15th through December 7th, or January 1 through March 31st, or any time of the year? So the answer is January 1 through March 31st is the Medicare Advantage open enrollment period. October 15th through December 7th is the Medicare open enrollment period. And the third one is for fun. So, all right. I'm going to stop sharing. And give yourselves a big round of applause because you have reached the end of your basic training. Congratulations to all of you. If I had the graduation music, we'd start rolling that. But you should feel very, very proud of yourselves. You all did wonderful. You will do great. And this is just the beginning of what lies ahead and so much more learning to do. But I'm sure, without a doubt, we all know that you will do wonderful and you can reach out to us. And anytime you're a volunteer coordinator, you're a regional training consultant, we are all supporting you and cheering you on along the way. Anyone else?
I think you said it well.
Yeah.
Thank you, everyone. Yes, and
Thank
we're
you
all
so
here.
much.
So what happens next?
Oh,
That was my question. What's next?
well, okay. Tomorrow you'll get an email with a list of resources and links and websites and lots of things that will keep you busy for as much as you want to be busy. And then we'll be offering some more training. I don't have the dates yet, but we have a series called New Counselor Training, and we do it's a 6-week series, and we do a little bit review of some of the information we've covered in basic training and then apply it to real life scenarios. And outside of that, you should contact your volunteer coordinator. They will probably have other things that they will be able to offer to you. Does anyone want to add anything to that?
Quick
Yeah,
addition. Sorry. Go ahead.
Oh, sorry. I would suggest reaching out to your volunteer coordinator because most of them have a process in place for after you finish basic training that they're going to want to incorporate you into counseling sessions, or they might have their own training that they do in-house at this point.
And a quick note about the privacy and confidentiality training, because we were running a little bit late on some of these things. You may have finished it and we may not have noted that yet, so just don't worry. And then if you have not completed it, you will get that information, or you have that information, and we'll ask you to go in and finish that up too.
Will there be additional trainings added to tracks as time goes on?
Tracks is for SMP, and so we don't use that. We use the SHIP TA Center for the training, for Medicare training, and so there's a lot of training that you can do in the SHIP TA Center, and that you can do independently. The links are shared in the email, I believe, that comes out tomorrow for those modules. And then there's some other training that you can do as well, like some self-paced training or online where you can review things and test. And one thing I'll warn you about is a lot of the materials on SHIP TA wording is funny. If you guys didn't like some of the things that it was today, one of the things I like to suggest is that a lot of times our clients don't know what they're asking us. And so it's all of the wording on the questions and the things that as we do our training practice, it's a really good practice for trying to figure out what the heck are these people talking about, because that's how you feel in your head oftentimes when you're trying to help someone and they're not sure and you're trying to untangle it, right? So just kind of be patient with the questions, and they're good practice for being in that situation where it can be a little confusing, and we have to kind of help people find their way. Okay.
Well said.
Noreen, I would add, I think if work with the volunteer coordinator, especially because each unit has their own way of doing things.
Yeah.
And most of us want to get you involved and active with clients as soon as you are ready. And not everybody gets ready as fast as other people. But yeah, it's, and then you asked about training. Every month, these ladies put together a couple fabulous training sessions. There's a lunch and learn on Thursday mornings, the first Thursday of the month, and then depending on where your SHIBA unit is, you have a continuing education session most months on various topics. So those are two regular trainings that are up, and I know my volunteers as well as myself find them extremely valuable.
Thank you, Annette.
All right. Otherwise, our hearts are warm that you wanted to stay on an extra 18 minutes with us. We appreciate it. Hope you have a wonderful rest of your day and a great extended weekend if you have one.
Yeah, happy holidays.
Yes, you too. Thanks for everything.
Thank you.
Thank you.
Look forward to seeing
Bye.
you around, Polly and Benjamin. Go Pierce County.
Bye.
Thank you all. That was a really nice group.
I'm going to stop the recording.